Endoscopic therapy is the preferred treatment for Barrett's esophagus. It is important to know that endoscopic therapy is not a one-time treatment. It is a process, usually taking about 3 to 4 sessions total. These sessions will happen over the course of about 6 to 8 months. If you decide to have endoscopic therapy, you will schedule your first therapy session. Each session will take up to 20 to 30 minutes. Before your procedure, an anesthesiologist will be there to give you sedation. There are 2 types of procedures we do using the endoscope during endoscopic therapy. One is called endoscopic resection, which means taking something out, and the other is called radiofrequency ablation, or burning. These 2 treatments work together to cure your disease. In the first treatment, we will use the endoscope to look very carefully at your esophagus. In this treatment, we will resect or take out any distinct visible abnormality that we find. Visible abnormalities generally are areas with the highest degree of dysplasia, or the most abnormal cells that have an obvious appearance, such as a nodule or bump. We take these areas out to remove the abnormality and also run tests on the sample to make sure there is no cancer. If we find cancer, which happens in less than 5 out of 100 patients in the area that we take out, the pathologist will tell us if it's superficial or deep. Superficial or intramucosal cancer can be cured by endoscopic resection. However, deeper or invasive cancer will require surgery. If we do not find any distinct visible abnormality during the first treatment, you will undergo ablation of all the visible Barretts and no tissue will be removed. Usually the next treatment will be scheduled about 2 months later. During every treatment, close inspection is performed to ensure there are no further visible lesions. If no lesions are seen, we can proceed with ablation. A way to understand why we do this process more than once is to think about painting a room. When you paint a room, you start with the first coat of paint. You let that dry, and then you come back the next day, and you see that there are a few areas that did not take. So you make sure that you touch up these areas with a paintbrush, or in this case, a smaller ablation tool. Similarly, because the esophagus is not perfectly straight, the first ablation treatment may also leave a few areas which are not completely treated. We then perform more treatments until the entire area is painted, or in this case, treated. Most patients will require about 3 ablation sessions to remove all the diseased tissue. Once your esophagus looks normal on endoscopy, we will take biopsies to make sure that there is no Barrett's esophagus or dysplasia left. In about 5% or 5 per 100 patients, the Barrett's may come back at some point in the future. Endoscopic therapy for your Barrett's requires a commitment from both the doctor and from you as the patient. We will work with you to make sure that the treatment fits into your life and your schedule. It is always important to talk about the risks and benefits of any procedure you may have. These treatments will be outpatient endoscopies. You will come to the hospital for the treatment, but you will be able to go home the same day. An anesthesiologist will be there to give you sedation and monitor the procedure. Risks of the procedure include some bleeding and the possibility of causing a small tear in your esophagus. These happen in only approximately 1 in 1,000 patients. This risk is similar to the risks of the endoscopy you already had to take biopsies. In about 5 in 100 patients, a narrowing in the esophagus may occur because of the treatment we are doing. If you develop a narrowing, you may have some difficulty swallowing. These narrowings or strictures are easily treated during endoscopy with a balloon which can stretch the scar tissue. After you have the treatment, either ablation or resection, you may have some discomfort. This discomfort is more of a nuisance in the majority of patients as opposed to reaching the level of severe pain. It would not be expected that you would need to come back to the hospital because of pain. Your doctor will give you prescriptions for pain medications to take after each treatment. Your esophagus may be a little swollen after the treatment. Because of that, we put you on a full liquid diet for a day or 2, and then a soft diet for 3 to 5 days after that. The entire process will take about 6 to 8 months. The chances of the treatment being successful are 90 to 95%. Even though the treatments are outpatient procedures, we will always talk with you after each treatment to discuss what we have done and remind you what you should do. And we are always here to help if you have any questions about your care. If you have any more questions about the risks and benefits of endoscopic therapy, please contact us.